AM 630. WMAL.
Coming up on WMAL at 8:37, we'll be joined by Larry Kudlow from CNBC. And by the way, did you hear that last-minute win for the Wizards last night? We're going to revisit that coming up in just a few moments. 8:07 on WMAL, where Washington comes to talk. Brian Wilson, Larry O'Connor.
The Wizards. We're doing a Wizards segment. Brett Barnes has a huge
hold on a
influence
minute. You should have heard it. You're not going to believe the audio.
I'm very excited about the Wizards. Joining us now, Dr. Betsy McCaughey. She's from New York. They don't know anything about basketball up there. Dr. Betsy McCaughey joins us now. She is the author of the brand new book, Beating Obamacare, Your Handbook for the New Health Care Law. Dr. McCaughey, thanks so much for joining us here on WMAL.
Well, thank you. And this is a great time to talk about the book because so many Americans are getting clobbered with the unexpected results of the law, even before most of its provisions go into effect in 2014.
Well, yeah, that's exactly why we wanted you here. And, we just took some calls from people who are just voluntarily saying, my God, I just got my paycheck and my taxes went up. I didn't know that was going to happen. Well, they ain't seen nothing yet with regard to how Obamacare is going to affect them, right?
Well, exactly. Most Americans get their health insurance through a job, either their own or their spouse's. And these folks are going to get bad news in the coming months. In fact, many of them already have, because in 2014, the law says that employers with 50 or more full-time workers have to provide coverage, and not just any coverage. They have to provide this one-size-fits-all government-designed mandated benefit package, which will cost about twice as much as what many employers currently offer. So employers are looking at that and saying, I'm going to drop coverage entirely and just pay the fine. Or some employers are saying, I'm going to push my full-time workers down to part-time status to evade this law.
Well, your book is called Beating Obamacare, so what can people do about this?
Well, they should be prepared because they're going to hear that they're no longer insured at work. Go in and talk to your employer and get the heads up now. And then they've got a couple of options. Some will enroll in Medicaid if they don't earn too much to qualify, but many, many people are going to find themselves on these state insurance exchanges, and you better be prepared with the information you need before that happens. It's like a DMV and an 800 number and a website.
Oh, Lord.
Right? You know what that's like.
Yes.
And these offices will only sell the one-size-fits-all government-mandated plan. It can have different names on it, like Aetna or Cigna or WellCare, but it's all the same essential benefits plan. It's kind of like going to a supermarket that only sells cereal.
You talk about the law of unintended consequences, or as I like to say, when laws are written, there are unintended consequences. And I would not want to be that 51st employee.
Oh, that's right.
Because if you're the 51st employee, you're going to lose your job, right?
Definitely.
And then the Democrats will say, oh my gosh, well, you know what? You don't care about people. You people in the private sector, you don't really care about your employees, and that's a horrible thing to do. But you know what? The problem is that in business, it's not government. In business, if you don't make money and if you spend more money than you bring in, you go out of business.
That's right. Also, the language that's used in the law and will be used at these DMV-style exchanges is really designed to fool you, but don't be bamboozled. They'll have 4 levels of plans: bronze, silver, gold, and platinum. This is definitely not like going to Tiffany's. All of these plans are the same. So if you spring for the platinum plan, don't think you're getting a higher quality of health care. You're just getting a smaller copay when you go to the doctor.
Dr. Betsy McCaughey is our guest. She is the former lieutenant governor of the state of New York, and she's the author of the brand new book, Beating Obamacare. And we're talking, Brian says that these are unintended consequences, but, there's a lot of people, I'm wondering if you agree with this, that deep down, the Democrats and Barack Obama really always sort of planned on doing a centralized healthcare system like in Canada or like in England. They've got to do it incrementally. And basically the plan here is that once Obamacare is implemented and all of the holes are exposed, and the fact that people will start laying employees off so that they can get around the Obamacare rules and regulations, it's just going to give them an excuse to say, well, see, this is the problem, and this is why we need to have a United Kingdom-style healthcare program.
Well, that may be true, but my job isn't speculating. My job is to just tell everyone what's in the law, and that's troubling enough. For example, you heard the president say that these health insurance exchanges are going to increase choice, right? It's not that at all. It's like going to a car dealer who only sells 4-door sedans. No hatchbacks, no convertibles. The idea here is that we are not smart enough. The public is not smart enough to make its own choices about what health plans they need, so they're going to make you buy that one-size-fits-all government-designed plan.
What about the biggest lie? When President Obama was selling this to the American people, he famously repeated over and over and over again, you like your health care plan now?
Yeah, you
Fine.
keep it, right.
You keep it, nothing's going to hurt you.
I've got a bigger lie, and he said it again yesterday in his inaugural address, that he's going to protect Medicare as we've known it. To me, the biggest shock in this entire law is Section 3000A. It awards bonus points to the hospitals that spend the least per senior.
Wow.
Wow. That means that if you're a senior and they got a choice about the level of care they're going to give you, they're not going to give you the level of care that would be in your best interest. They're going to give you the level of care that would be in their best interest.
Of course, if you have a dog you love, you don't take him to the vet that spends the least per animal. Why would you take your mother to the hospital that spends the least per senior?
That's certainly not Medicare as we know it. Well, let me ask you, there's been a lot of vitriol in the media and from the left toward some of the very brave CEOs that have come out in corporate folks who have come out and said, my God, Obamacare is a real problem and we're going to have trouble moving forward. And I'm not talking about, traditionally conservative industries. I mean, John Mackey, the CEO of Whole Foods. I mean, I go to Whole Foods and I'm the only Republican there. I can
right.
tell by
you
their
can't
shoes.
Even buy white eggs there.
That's right. John Mackey has said he's compared Obamacare to fascism. What do you think of that?
That's right. Well, and the entire law presumes that Americans have no ability to make their own decisions, don't deserve any medical privacy, right? And the government can take as much as they want and determine who the winners and losers are. And clearly in this law, seniors are the biggest losers. When I heard Richard Foster, the chief actuary of Medicare, warn Congress that some hospitals will stop accepting Medicare, where will seniors go when their local hospital stops accepting Medicare?
Well, that's my question for you. I mean, again, if we can give people some pointers here, I mean, as these things are rolled out, other than just being prepared and ready for them, is there anything anybody can do?
Let me give you a pointer. If you're a baby boomer, so you're not going to be ready for Medicare for 4 or 5 or 6 or even 10 years, number one, lock in your relationships with doctors now. An internist, for example, a cardiologist, because when you turn 65 and go on Medicare, you will not be able to find any doctor willing to take you on.
Yep, good advice.
That's a great idea. All right, Dr. Betsy McCaughey, thanks so much for joining us. Again, the book is called Beating Obamacare, your handbook for the new health care law, and it's got everything you need to know moving forward into the new age of Obamacare.
I have a feeling it's going to be a bestseller.